Hello, here we are for the self-breast examination demonstration. Like we said yesterday, let's go and do a self-breast examination. Here we are. So how to do? For you to be able to do a self-breast examination, you ought to have two things. Number one, you ought to have a mirror. Number two, you have to have your hands. So for the mirror, you just need it so that you stand in front of the mirror like this. You look at your breasts, the color, the shape, and the size. How many things? 3. The color, the shape, and the size. Are these the ones you are used to since you are a small girl? Or they have changed. When it comes to the color, most of the times we check the skin. If the skin is having some the skin looks like the one of an orange or a lemon, that is with the small holes. You can observe and see a site where you can see those small holes, like the ones that are found on the peel of an orange or a lemon. That is not a good sign. Number 2, if you find your breast has some dimples, you know the dimples that people have on their cheeks. If you find that kind of dimple on your breast, that's not a good sign. If you are used to your nipples coming out and then all of a sudden you realize there is one that is going inside, that also is not a good sign. So on the look, you are looking at the color of the breasts. So the skin, we have said if you find that the skin is having those small holes like the ones that are found on an orange or a lemon, that's not a good sign. If you realize your nipple is not the way it is used to be, that is out, facing out, one of it is maybe going inside, that's not a good sign. If you find there is a dimple on your breast, that one is not also a good sign. On the size, if you are used to your breast being the same size always, and all of a sudden you realize there is one that is bigger than the other, that one also is not a good sign. And that one should promote you to go to see a doctor as soon as possible, or a health provider of a health facility that you have chosen. Do you remember in the other clip I said you should be having your own health facility of your choice where you should be going for healthcare services? Yes, then there you are. Now we come to the next step. We said the first step is for looking. The second step is for feeling. Remember the breast, we say, though you just see this part that is protruding, the muscles of the breast start from the collarbone, going to the upper part of the abdomen, and going to the inner part of the armpit. Yes, your breast muscle is situated right from the bone collar, upper abdomen, and into the armpit. So when you are doing a self-breast examination, it is very important that you expose your breast. How do you expose your breast? This hand will check this breast, and this hand will check this breast. So when I'm doing the left hand breast self-examination, one should lift the hand. Put 2 imaginary lines on your breast, and then it's going to give you 4 parts of the breast. Put 2 imaginary lines on your breast, then it's going to give you 4 parts. There is part 1 near the armpit, part 2 near the collarbone, part 3 near the abdomen, and again part 4 near the upper part of the abdomen. Then there is another part that you get, which is the middle part of the breast. Yes, so the parts will be 5. 1, 2, 3, 1, 2, 3, 4, and 5. For you to feel, you use your hand, especially the first 3 fingers, the paddings of your hand. Then you press the breast. Remember we said up to the armpit. You press like this, press like this, press like this, press like this against your ribs, and then in the middle. Then on that nipple, you also ought to check the nipple if there is any distance that is coming from the breast. So you pull the nipple and rub against your first and the thumb, first finger and the thumb, the other one the same. If you notice there is anything that you are not used to do, kindly go to the health facility of your choice, where a health provider is going to do more detailed examination and is going to advise accordingly. When I finish with that breast, I come this side, I lift the hand, I use my left hand again, I divide the breast with two imaginary lines. Then I remember that the breast muscle is from the collarbone to the lower part of the abdomen to the inner part of the armpit. So when I put my two imaginary lines, it's going to give me part 1, part 2, part 3, and part 4, and then in the middle. When I'm checking for anything, I rub against the rib, rub against the rib, rub against the rib, rub against the rib, and then rub against the rib. When I take the nipple, I pull and I rub between my fingers. I pull and rub against my fingers. In case I realize there is any discharge, then I should go to the health facility of my choice for further examination. Is that understood? Have I said something as Grace the Nurse in this YouTube channel? Thank you. If you have any question, don't forget to ask and also subscribe, and then you also pass to your friends. Thank you.